Hello, Dr. Eva Fisher here, answering your questions about body dysmorphic disorder. Another question I frequently hear from people is, well, I've heard that SSRIs, or what's also known as antidepressants, can be helpful, such as Zoloft or Prozac, for people with BDD, but I don't want to get addicted to them. Are they going to be addictive? What are the side effects? Well, I was on Prozac for 2 years when I had body dysmorphic disorder, and I was on a fairly low dosage. I was only on 20 milligrams for the 2 years I was on it. However, according to BDD therapists, dosages can go up to 60, 80, 100 milligrams for people with body dysmorphic disorder. And that's totally a conversation for you to have with your psychiatrist who can prescribe medications for you. However, I will say that selective serotonin reuptake inhibitors, also known as SSRIs, are not addictive. And in fact, what they help to do is to basically keep the serotonin in your neurons, in your brain, from being reabsorbed as quickly. And again, serotonin is like dopamine, it's kind of a feel-good chemical in your brain. And it helps to basically alleviate obsessive thoughts, compulsive behaviors, and feelings of depression and anxiety in people with body dysmorphic disorder. That being said, medication alone or taking medication alone without getting therapy will not help you recover. It will alleviate some of the symptoms of body dysmorphic disorder, but then the medication must be used in conjunction with therapy in order to truly recover and to get the BDD symptoms under control. Another thing I point out to people in my support groups is if your brain was functioning properly, you would not need any medication. However, the classification of someone with body dysmorphic disorder is that it's a mental health condition that causes depression and anxiety and suffering around how someone thinks they look or perceived defects in their appearance. So again, if someone's brain is functioning normally, they would not have BDD and they would not need medication. The point of taking medication when one has BDD is to basically get one's brain to function more normally. It's not addictive. And I am never going to say that I'm pushing medication because I'm not a psychiatrist, but it helped me. It really helped to alleviate my obsessive thoughts about my nose and my depression and my anxiety. And that made all the difference in making sure that the therapy was effective in helping me to recover. So don't be afraid to take medication if you think it will help you to recover from your body dysmorphic disorder. Dr. Eva Fisher here, answering your questions about body dysmorphic disorder.